I completely understand the inconvenience and distress this late change will cause millions of parents and pupils up and down the country. Parents whose children were in school today may reasonably ask why we did not take this decision sooner. And the answer is simply that we have been doing everything in our power to keep schools open because we know how important each day in education is to children's life chances. And I want to stress that the problem is not that schools are unsafe for children. Children are still very unlikely to be severely affected by even the new variant of COVID. The problem is that schools may nonetheless act as vectors for transmission, causing the virus to spread between households. Today, the United Kingdom's chief medical officers have advised that the country should move to alert level 5, meaning that if action is not taken, NHS capacity may be overwhelmed within 21 days. Of course, there's one huge difference compared to last year. We're now rolling out the biggest vaccination programme in our history. So far, we in the UK have vaccinated more people than in the rest of Europe combined. With the arrival today of the UK's own Oxford AstraZeneca vaccine, the pace of vaccination is accelerating. By the middle of February, if things go well, and with a fair wind in our sails, we expect to have offered the first vaccine dose to everyone in the 4 top priority groups identified by the Joint Committee on Vaccination and Immunisation. That means vaccinating all residents in a care home for older adults and their carers, everyone over the age of 70, all frontline health and social care workers, and everyone who is clinically extremely vulnerable. If we succeed in vaccinating all those groups, we will have removed huge numbers of people from the path of the virus. And of course, that will eventually enable us to lift many of the restrictions we have endured for so long. I must emphasise that even if we achieve this goal, there remains a time lag of 2 to 3 weeks from getting a jab to receiving immunity, and there will be a further time lag before the pressure on the NHS is lifted. So we should remain cautious about the timetable ahead. But if our understanding of the virus doesn't change dramatically once again, if the rollout of the vaccine programme continues to be successful, if deaths start to fall as the vaccine takes effect, and critically, if everyone plays their part by following the rules, then I hope we can steadily move out of lockdown, reopening schools after the February half-term and starting cautiously to move regions down the tiers. I want to say to everyone right across the UK that I know how tough this is, and I know how frustrated you are, and I know that you've had more than enough of government guidance about defeating this virus. But now, more than ever, we must pull together. You should follow the new rules from now, and they will become law in the early hours of Wednesday morning. Parliament will meet largely remotely later that day. I know that the devolved administrations in Scotland, Wales and Northern Ireland share my conviction that this is a pivotal moment and they're taking similar steps. The weeks ahead will be the hardest yet, but I really do believe that we're entering the last phase of the struggle because with every jab that goes into our arms, we are tilting the odds against COVID and in favour of the British people. And thanks to the miracle of science, not only is the end in sight, but we know exactly how we will get there. But for now, I'm afraid you must once again stay at home, protect the NHS, and save lives. Thank you all very much.